Alright students, let's get started. Today we are covering SOAP notes. So the MBLEx is going to have 17% on client assessment, reassessment, and treatment planning. Essentially there will be 17 questions out of 100 on material similar to what we will cover today. So make sure you know this stuff. So let's go ahead and dive into this. What are SOAP notes? They're a popular method among healthcare professions to record client and session information, also known as SOAP charting. So what does the acronym SOAP mean? S is subjective, O is objective, A is assessment or application, and then P is planning. So let's go ahead and dive into this and see what each one of these means. So subjective, according to Oxford Languages, it is based on or influenced by personal feelings. Make sure you understand that. Personal feelings, taste, or opinions. This is information that the client gives the therapist. Now this can be written on the intake form or verbally during the initial consultation or pre-interview. This information would go in the subjective portion of the SOAP notes. It can be direct quotes from the client such as stated by the client, yes, my neurologist recommended I begin massage therapy treatment 6 weeks after surgery, after being asked if they have been medically released for massage. List any areas of concern that your client mentions, as well as areas to avoid. Now this is important, so that one, you do not forget what areas not to massage, and two, you make sure to ask your client during subsequent sessions if they would still like you to avoid these same areas before you treat them again. Also, health history. This can be on the intake form or acquired during the initial consultation, pre-interview, and even during the massage treatment. Symptoms, where the client is experiencing pains, aches, or soreness, what's its intensity. This can be described using a pain scale of 1 to 10, 1 being hardly any pain and 10 being excruciating pain. Frequency, how often. Duration, how long has the pain lasted. Onset, when and how it started, and then what makes it better or worse? Which activities aggravate or relieve it? For instance, standing, sitting, or laying down. Does this help or does it make it worse? And then client expectations or goals. So I make it a habit to ask my clients during the initial interview what their goal is for each session. This gives me a better idea of exactly why they are seeking massage therapy services. For instance, if they say, I just want to relax, I'm very stressed, and I hold all the tension in my neck. I know that they want a very relaxing massage with extra attention on their cervical region. So they just want to relax. Okay, so that is their goal. This is something that I would list in the subjective portion of my notes. And then lastly, changes from the previous sessions. During subsequent visits, it's a good idea to ask about any changes from the last session, how they felt after their last massage. I've had clients tell me that they felt much better and they didn't realize how beneficial massage really was. This is all information you would want to put in the subjective portion of the SOAP notes. Now let's see what objective is. Objectives, according to Oxford Languages, is not influenced by personal feelings or opinions, in considering and representing facts. Facts is the key word here. Let's see. Objective. This is information that the therapist gathers and or observes during observation, the interview, or during assessment. So perhaps your client comes in with a cane or a walker. This is information you want to chart, especially for other therapists who may work on this client next. If the client needed any help with accessibility into the building and or on and off the table, you should chart this. Also, if you needed to modify the massage to accommodate the client's comfort or needs. So real quick story, I had a client with left-sided weakness from a stroke they had many years ago, and they were legally blind. And the client had difficulty laying down prone. And after we tried it, it was very unsuccessful. The client was not able to breathe. We then tried a massage chair, and the client could not get comfortable in this either because the client kept sliding forward. So finally, we just decided to just do the massage sitting in a chair, and I worked on the client's upper body only. This worked out perfectly. And in the SOAP chart, I recommended this client be a one-on-one with me since I was familiar with their medical history and accommodations. However, it is necessary we chart the client's information just in case the client decides to see another therapist. Perhaps I'm not there for the day, and the treating therapist is able to review the chart and know exactly how the client was treated previously, and know the client's medical history as well as any accommodations that were necessary when I treated the client. So you can see why SOAP notes are so important. Next is visual findings. Perhaps the client has a shuffling gait. Gait is just another word for how the client is walking. Perhaps the client is required to wear supportive shoes for toe amputations. This is objective information that needs to be charted as well. Palpable findings would be anything the therapist notices about the quality of the tissue. Perhaps the client has congestion or tension in the tissues. This is objective information. And any test results. Range of motion, ROM. Perhaps the client is not able to abduct the left arm more than 90 degrees at the glenohumeral joint due to a stroke. Let's say the client's goal was to be able to turn on their light switch at home. These test results should be charted in the objective portion of the chart. And then finally, the therapist's treatment goals are recorded. So for instance, in this case of the client with a stroke, the therapist's goal can be targeting the muscles that are constricted and that are responsible for abduction of the shoulder, such as all the fibers of the deltoid and the supraspinatus, so that the therapist can meet the same goal as the clients. Any objective information are just facts. Make sure you understand that. Next is assessment. Assessment is the evaluation or estimation of the nature, quality, or ability of someone or something. And then real quick, application is the action of putting something into operation. So let's see. What was done in the treatment session? This is the information that goes in assessment and or application section of the SOAP notes. For instance, the client received an 80-minute full body massage with a hot pack on their lower lumbar and hot towels on their feet. You're going to list any changes in symptoms, pain relief, responses of the client. For instance, I notice on many of my clients after I remove their hot packs, the tension in their muscles decreases significantly, likely due to the increase of blood to their tissues, making it much easier for me to work on these areas more effectively after removing the hot pack. Any subjective or objective changes. For instance, does your client tell you their headache is much better or their neck pain significantly reduced? This is subjective progress that you can list in the chart. Objective changes would be like the back scenario. After I removed the hot pack from the client's back, I noticed the reduction in the congestion of the client's tissues. This is objective progress that we want to list on their chart. And then finally, any positive or negative progress. So positive progress, the client feels much better. Negative progress could be that the client had a muscle spasm as they turned over from prone to supine, which has unfortunately happened to one of my clients I was treating. So this would be considered negative progress, and it's something you would want to list under assessment. And then lastly, planning is the process of making plans for something. So planning for the next treatments. These are suggestions for future sessions. I've had clients ask, how often should I receive a massage? And I'm curious, what do you all think? Let me know in the comments what you would recommend your clients if they asked you this question. Recommendations made to the client. So this is anything you tell your clients. I had one client who hurt their back during some gardening, and after the session, I educated them on some better lifting techniques when they were working in the garden. So these are any recommendations made to the client. The next session plans, frequency and number of sessions. And then long-term goals and plans. An example of a long-term goal and plan would be to help the client achieve 5 to 10 degrees more flexibility at the glenohumeral joint when performing abduction, so that they can meet their goal of being able to turn on the light switch at home. Okay, so now let's test your knowledge over the material that we covered. So the first one is, client received a 50-minute full body massage with a hot pack on the lower lumbar. What would this go under? Subjective, objective, assessment, or planning? So if you said assessment, you are correct. This was done in the session, and that's what portion it would need to go under. Next, client requested to stay in the prone position the entire massage. client requested. What do y'all think? If you said subjective, you are correct. These are client expectations. They want to stay on the prone position, so make sure you accommodate their requests and expectations. Next one, client has a history of high blood pressure, controlled with medication, taken once in the morning every day. How about this one? This one is also subjective. This can be written or verbally, and it is information that the client tells the therapist. Next, client mentioned having a lot of tension in their cervical region, resulting in a persistent tension headache. Again, subjective. These are things that the client is telling the therapist. Next, notice client had a bruise on the lateral right upper thigh. Client was made aware of this after the massage. What do y'all think? It is objective. Okay, these are facts. This is something that the therapist noticed. Okay, and so real quick, let's talk about if a client has a bruise. So you definitely want to let your clients know that they had a bruise. That way, if they did not notice, you don't want them to believe that this is something that they acquired while they were receiving a massage. Now, I would recommend waiting after the massage to tell your clients about this, because you don't want to tell them during the massage and then them focus all their attention on it. Okay, so I would say after the massage, hey, just to let you know, you had a bruise on that right upper thigh. Just wasn't sure if you were aware of that. Okay, so that is objective because those are facts. The bruise is there and I can visually see it. And then lastly, client rebooked for massages bi-weekly and client scheduled 2 weeks out with me. What do y'all think? Very good. If you said planning, you are correct. And then lastly, you are closer than you think. Keep going. You've already gotten this far. Okay, so do not give up. Keep going, keep studying, keep putting in the work, and eventually you will be a licensed massage therapist. Okay, so as always, feel free to reach out to me with any questions or comments concerning this material. If you found this video helpful, let me know by clicking the thumbs up. Don't forget to subscribe so you won't miss out on the content I will post every week. Also, don't forget to share this video so we can reach and help other massage therapy students on their journey to becoming massage therapists. And remember, your feedback, comments, and questions help me and all the students on here grow and learn as we run through the content that will likely show up on the MBLEx. Y'all have a wonderful rest of your day, and I will see you in the next video. Y'all take care.